And we were pleased to have Horst Krämer here with us today. He is the project officer at the unit e-health, well-being and aging at DG Connect at the European Commission. And you will now present the upcoming opportunities within the recently launched work program for 2018-2019, because for 2020 we don't know anything yet. And we were pleased to have you here today. And now really listen carefully, because this is the day when we really have the time and the day to ask the question and know all the details. And we take the questions together and after the presentation, I think, if it's nothing urgent, because we need to have the microphone for questions since we are web streaming. But please go ahead, the floor is yours.
Thank you very much. Also, thanks for the. Am I on? It was muted. Okay, there we go. Thank you very much also for the invitation. It's one of those things, we have a new work program. It says 18 to 20, but it's true for 2020. There will be updates later on, so I will focus on mainly on 2018. And whenever we have this new work program, it's really a good opportunity to not only have these big central information days that we organize in Brussels, or but also to go to member states and talk to those that are potentially interested in the work program. So that's thank you very much for the invitation. That was really good, and I'm very impressed by the introduction of Horizon 2020. It's the best one I've seen so far, so it's really well done to really make sense of it. Adding to that, though, I think I want to give you a little bit of a taste of what to expect from my presentation today. As you heard, I represent a unit in DG Connect, and DG Connect is the department in the European Commission that is concerned with everything digital, if you like. It used to be called Information Society. There's a lot of technology focus there, so we do policy and we do research funding. And from the overview that you've seen from Horizon 2020, you saw that there is an ICT part, and we do a lot in there. But we also have a directorate in DG Connect that deals, if you like, with ICT for society. So mainly what is represented in the third pillar that you saw, societal challenges. We do collaborate in the drafting of the work programs for research and innovation funding with the colleagues in DG RTD, so the research department in the European Commission, and sort of the budget is divided a little bit, if you like, and the calls are coordinated between us. I will focus on ours, obviously, as you can imagine, the interface between ICT and health, which is also the interface, if you saw the actual societal challenge, it's not only called health, it's health, aging, and well-being. So that's the realm in which we are, and it happens to be the largest societal challenge in terms of not only importance but also budget. So that's what we're talking about today. And as your Horizon 2020 is a research and innovation program that is motivated by impact, if you like, so societal impact, but also scientific impact. It is always linked to certain sort of headline goals, if you like, and impact targets. The overall headline since the economic crisis was always jobs and growth. That's everything that guides the European Commission politically, and then that is translated into different policies. And in this case, we are looking into how this is projected, if you like, into the societal challenges. And for that reason, I would like to start with a little bit of a policy context, because that is really important to the way that these calls and topics are drafted and what they are aiming at. Then we're looking into individual topics that you might be interested in applying for. And then I think we can discuss individual ones, and I would also like to hear from you which ones you may be more interested in, and then we can take it from there. So let's dive into it. So if we look at, oops, did I push the wrong? Oh, I pushed the wrong button, I think. It's these two. We go for F5, I guess. So. I didn't recognize that slide. It wasn't mine. Okay. Are we there now? Still not? There we are. You may have heard of a thing called the digital single market. Who has heard about it? Good. So the easiest way to introduce that usually is to say Europe is built about a single market in general of goods and services. And the Commission has realized that there's still a lot to do in terms of digital services. One very famous example is the fact that we have abolished roaming fees for phone calls. But a lot of other things are about digital content, geo-blocking, these kind of things. And that was introduced 3 years ago. And as it happens with these kind of policies, after a while, you have to see whether you're making progress or not. And earlier this year, the Commission published a midterm review of the digital single market. And for the first time, when the Commission looked at what has been achieved, where still needs something needs to be done, it was realized that there is a lot of development in digital technologies in the health sector, and we haven't looked at that in the context of the digital single market yet. And we have to do that. So it was introduced in this midterm review as one of the priority areas where more needs to be done in Europe to sort of reap the benefits of European integration, and also in the markets that are there for products and services in the health sector. More specifically, 3 pillars, they're called pillars again, I'm sorry for the Euro speak, were introduced to focus on. The first one on access to health records and health data, mainly by citizens and for citizens. The second one about using digital infrastructures for research and personalized medicine, and that is beyond national borders, beyond infrastructures that are there, for example, at particular research institutions, applying them, for example, to, if you like, genomics research or personalized medicine in general. And the third one is about sort of the changing roles of citizens, patients, and health and care providers, and the question of how innovative approaches to health and care provision can be scaled up, if you like. So that's the 3 pillars that were identified as homework, if you like, to work on. And the European Commission is preparing a so-called communication on these 3 pillars. A communication is, if you like, a policy paper that lays out priorities and policy proposals for the next few years, how to tackle these things. And that includes targeted funding for projects with different instruments in these fields. So that's one of the backgrounds. The other instruments that we have beyond funding, for example, through Horizont 2020, but also through structural funds and other instruments, are legal measures. So where do we need, for example, to intervene in terms of standardization? Where does it take more in terms of the implementation of privacy and security? These kind of things. And we can also act as a catalyst, if you like, in terms of network building, cooperation across Europe in a more informal, bottom-up way between initiatives that are out there. Examples that we put on the slide. There's a thing called the e-health network, which is representatives of member states authorities coordinating their policies on e-health. And there's a very prominent thing which is called the European Innovation Partnership on Active and Healthy Aging. That's a very bottom-up network of hundreds or even thousands of institutions cooperating in innovation for active and healthy aging, which goes from adherence to prescriptions to age-friendly environments, interoperability questions, integrated care, these kind of things. And the Commission can act as a sort of catalyst facilitator for these networks and support them. And the headline goal of this digital single market context is transformation of health and care in a digital, with a digital component. And there are several aspects to that, which are then reflected in also in the calls that we have. One is the sort of shift from sort of treatment and acute care to long-term care perspectives. Another one is the one that goes away from again from treatment more to towards prevention. You may know these figures about how much is spent on treatment of diseases and how little is spent on prevention, even though everybody agrees that prevention is the way forward because we have to make our health systems more sustainable. The question of the shifting roles, the patient or the citizen becoming taking a more active role in management of health. Quite practically shifting some parts of health and care provision from institutionalized care to the home, and a more personalized approach also based on the opportunities that we now have in terms of data analysis and more targeted treatments and prevention measures. So these are the dimensions of that transformation. And it is, of course, backed up by these huge, rapid developments that we have at the moment in terms of data. So big data is one part of it, but there's also the application of the big data, the questions of the infrastructures that we need. The Internet of Things is one part of it. The fact that more and more data can be accessed in a mobile way if we are rolling out, for example, new transmission standards like 5G. The role that wearable technologies are playing, they all feed into that and open new opportunities. And now if we look at how this translates into the work program, what I would like you to understand is that there are different calls, and Johan presented it quite well. You don't actually only have to look at one call to find your field. You have to be a bit creative also in searching on the portal to see in which areas there are things. One example, for example, which many people are not aware of, we have quite a few health-related projects in the ICT part in Horizon 2020 as well. And it may not even be in the call text that it is about health, but it can be about health if a particular technology is applied. So this kind of thinking is part of Horizon 2020. And practically, we have the call on better health and care, economic growth and sustainable health systems, the triple win, the triple goal that is sort of guiding these calls. Then we have the one that is really reflecting what I was talking about in terms of the digital single market transformation in health and care. And then we have a more specific one on cybersecurity and privacy, if you like. So the trusted digital solutions and cybersecurity in health and care. And then there are some other actions, and I will go into some of the details of these topics. For the moment, I would just like to stress that, again, if we're looking at this impact-oriented approach in Horizon 2020, what does that mean particularly for health and care? It's, on the one hand, it's about rolling out new approaches that sort of try also to tackle inequalities in health systems. It's about patient empowerment, a bit about this new role, about more accountability, if you like, more accessibility of data and treatment and prevention of, for example, chronic diseases. It is done by means of e-health and m-health. Some might argue m-health is the same basically these days as e-health because most technologies are becoming mobile, m-health mobile. And it is a particular focus on aging societies, which is a particular challenge also in Europe with demographic change and sort of more need for long-term care, for example, more questions about transition from working life to retirement, more questions about prevention of chronic diseases and these kind of things, assistive technologies. There's quite a few policies that are related to that. You will have access to the slides later on. So have a look at these if you're interested. I have a long list of links at the end of my slides as well if you want to look into the details of these. And with that, I would like to go into the topics. Maybe I would open for questions quickly if there's anything on the general part that is not clear.
Do we have any questions? I have a question, of course.
Sure.
I mean, you talked a lot about the political context, and sometimes even if you see it's important, so on and so on. But if I'm only interested in writing good application, why is it important to know the political context? I mean, I'm just interested in the tiny call.
Yes, it is absolutely critical to know about the political context. You don't have to know all the details. You can't know all the details. That's for sure. But as I said, there is a big focus on impact, and impact is what drives the way that these calls are shaped. And even if it's one tiny call, if you're aware of how it contributes to the expected, that's why there are expected impacts in the program, how it contributes to these goals that are also driving the policies, then you will write a better proposal. You will have a better chance of being funded afterwards. So these principles are reflected in the calls as well. Of course, there are ongoing policy developments. Not everything can be word by word in the work program for Horizon 2020, but it will help to be more successful. That's what I can say. Depending obviously on the context, if you have calls that are more oriented towards, for example, particular disease or a particular application area. But again, they are there for a reason, and reasons are impact oriented, and societal impact, economic impact, scientific impact. These are the components.
So keep track on the political context. But I mean, if I'm really new into this, and you see the impact you're talking about, we will see it later on when you're presenting the call. Does it say the impact, look at this political context, or do I have to figure it out myself? I'm trying to be...
we can't... so if we want to have this long list of links in every particular topic, then the work program would be 5,000 pages longer. But what you will find are sort of markers, pointers. You will find particular words, phrases that point towards that context. And there's also something that we call a chapeau in the work program that introduces the work program, and that makes reference to these policies. Of course, it would be artificial to say you have to tick all those boxes in your proposal. But you have to understand the spirit in which it is written, and if you manage to match that, then it's possible. Of course, you can't know everything. That's for sure. But that's one of the reasons why I'm here to give you that context.
So if just to clarify, so I read the introduction. I don't skip the introduction of the work program because that's important, even if it might sometimes feel not that interested, because there you have the political context.
Yes.
And with your slides now from the beginning, don't skip this one and have a look at the political context, but because that's very important.
Yes, because as I said, it's crucial, it's critical if you are serious about the third big criterion in your proposal, which is impact.
Okay, thank you for clarifying. Any other questions? You are following this much better than I do, obviously.
Yeah, I would think that with every sentence I say, I raise a lot of questions. But okay. Good. We don't have to go through this one by one because we will talk about these topics now. I would just highlight that very practically, if you're interested in these topics, in the coming year, there are 2 deadlines for these topics. One is in April and one is in November. And I will mention topics for both of them. The ones in April, you have open calls, so theoretically you can submit a proposal now, but you have to do it before the end of April. Is it the 24th? I'm not sure. So it's the last week of April. It's on the slide. So that's the timeline. So it's true. There's enough time, but in terms of finding partners for a consortium developing an idea, I think it is about time to get going for these. Otherwise it will be tricky. Just a quick word on the different instruments. Thank you very much for introducing PCP and PPI. That's very important because they are very special animals, if you like, and procurement in the field of health obviously plays a big role because you have a lot of things that are procured by the public sector. And apart from that, Horizon 2020 mainly distinguishes research and innovation actions. So the more research-oriented projects, if you like, innovation actions, which in many cases translates into piloting, so closer to market, closer to rollout, if you like. And they are complemented by so-called coordination and support actions, smaller projects which provide support in terms of administration, coordination, consultation to other projects, but also to stakeholders and other networks that are not in projects. Sorry. So I will introduce those as well. So let's look at the first one. Thank you very much. We are in the call of digital, thank you, transformation of health and care. And this one is a research and innovation action that is called Adaptive Smart Working and Living Environments Supporting Active and Healthy Aging. AHA is Active and Healthy Aging. The specific quality of this one is that, at least for Horizon 2020, it's the first one that we're combining the living environment with the working environment. And this is what sets this apart from many other topics. And it is actually a requirement to look into both and into how to combine that. I was talking previously about the new challenges of sort of aging societies, but also for older workers of the sort of more diverse ways of shifting from work life to retirement. And this is what this looks at. My slides, just to explain, they're always structured in the way that the topics are structured as well. So there's always a challenge, there's the scope, which describes basically what is to do or what is to be proposed, and the impact that we talked about just now. And this one, to cut it short, is mainly about, if you look at this first bullet point, digitally enabled adaptive services and solutions leading to smart working and living environments for older adults. So there is an ICT component. Whenever you see the word smart, you know that there is an ICT component, that's for sure. So that's one of those markers. And this is what this is about. There are a lot of, oh, I'm sorry, backwards, sorry. There are a lot of framework restrictions, if you like. For example, when we're talking about technological support for working environments, but also for independent living, for example, the focus is not necessarily on the technology itself, but the technology has to be advanced so that it is unobtrusive. It doesn't take away too much of the attention of the user. It is not too demanding to use. So these kind of questions need to be looked into. And it clearly has also a health and prevention dimension, because it is about questions about specific challenges for older workers when it comes to physical demands, or when it comes to obligations outside work. For example, care obligations could be something to look into that shall be addressed with this topic. And if we look at the impact in this one, it is clearly about enhancement of quality of life. It is clearly about independent living, and about people staying actively involved in the working life as well. So I saw a lot of hands of people that were involved in FP7, for example, I think. And in FP7 we had already quite a few calls and projects about independent living. More related, for example, to monitoring, things like fall prevention, early detection of frailty, these kind of things. This is related to that, but it sort of bridges the gap to the involvement in working life. So that's the particular one about this one. All these topics have a multidisciplinary dimension. It's important to mention. And in the terminology of Horizon 2020, it's not only multidisciplinary, it's even transdisciplinary. And transdisciplinary meaning that the idea is to also incorporate knowledge that is not generated by sort of classic academic research or disciplines, but also, for example, by users, that comes from other sources. So this is what we're looking at here. There's a design component, markedly user-centric design component, and the idea of sort of intuitive ways of human and computer interaction. In terms of the impact and the policy context, we do expect sort of proposals how to measure a socioeconomic impact. For example, that's just an example, how to ensure that people can stay in their jobs for longer and how that will affect the labor market, but also the economic effects in general. And we think it should have a markedly European dimension in terms of Europe being sort of a leader in this field and being competitive. Technicalities, yes, the submission deadline is the 24th of April, I was right. It's a research and innovation action, and the indicative budget is 25 million. Indicative budget always means that this is what is allocated to it in the work program. It may change depending on results of calls. So there may be budget shifted from one topic to another, but there are restrictions on that. And we do give sort of indications also as to what kind of size of project we do expect. In this case, we say 4 to 6 million per proposal. This is not a criterion, if you like. So if the proposal is 6.5 million, that's certainly not a reason for exclusion. But this is sort of the expected contribution per proposal, and it also gives you an idea of how many proposals will probably receive funding in the end. It's, again, this is not something that you can easily calculate, but it is an orientation in that direction. The next one, another research and innovation action, which is, if you like, a bit broader in application area, but a bit more specific in terms of technology. It's about in silico research and personalized diagnostics, and the fact that we were discussing earlier that every word in the text counts, and the fact that it says exploiting the full potential here is on purpose. That it's not just blah blah. It basically hints at the fact that research has already been done on this. And this is about getting it to the ground, basically, and exploiting it. So these are the little hints in the text, basically. One of the barriers that have been encountered in sort of technology-based diagnosis and sort of treatment decisions have been about validation and trust. So this is what this aims at as well. Making sure that these solutions are actually trusted both by those who apply them and both by whom they by those that affect them. And it is about using the resources that have been developed and that are developed. So having access to sort of high performance computing, having access to big data analysis tools and technologies, the data infrastructures, and doing that in a cloud-based environment with the necessary precautions for security and data privacy. So this is the challenge, if you like, and it does aim at development and validation. So that's describes the again in the terminology of Horizon 2020 the technology readiness level. Development means you are allowed in this project to propose something that is not there already, but you can and are supposed also to build on something that you can bring into the project. and it is supposed to support decision making in clinical practice, for example, and personalized disease management, specifically of non-communicable diseases. So that's the scope in this one. The examples for what it can support are on the slide. So the use of particular medication, diagnostic methods to be used, tools to be used, and so on. And again, it must be part of the project to use shared infrastructures. So if you say we have a good facility in our hospital and we're going to use that, if that's the only thing that you're doing, then you're probably not aiming in the right direction. And we ask to, where possible, link to existing and emerging European initiatives in this field. This is, again, an implicit hint at the policy context that I was mentioning earlier. If you remember the 3 pillars of the digital single market, the second one was about research infrastructures and data infrastructures for personalized medicine. And this is where this comes in. So this is where you see these relations to the policy context. Again, we are looking at socioeconomic impact, but in this case specifically the idea of scale, about making this happen at a larger scale. The impact is also on the quality of the data, because the assumption is that the more data you can use, the more you can also validate, and the more you can sort of make sure that data is cleaned, for example, and validated against each other, and also against sort of more traditional methods. So that's part of this project. In our context, 35 million euros for a topic like this is quite a lot. And it's even more if you look at the expected contribution is 10 to 15 million per proposal. So in the overall context of Horizon 2020 and Societal Challenge 1, this is in the ICT and health part quite exceptional in terms of the size of the project that we're expecting. So a lot of validation work will be done. A lot of this can expect it to be about infrastructure, about actually linking into the existing infrastructure. So that's why the budgets are a bit bigger. The next one, again, clearly has a link to the policy context. I was saying earlier, the first pillar in the digital single market was about access to electronic health records and management of health data by citizens, by patients. And this one asks to prototype a European electronic health record exchange. So it's not necessarily only about developing an electronic health record, but it's about the possibility to exchange data that is stored as part of electronic health records in a decentralized way, if you like. So we see that a lot of efforts are being done in terms of standardization of health records. There are private providers that put solutions out. There are individual hospitals. There are regions, countries that develop their own ones. This is not opposed to that. It's the idea of making it accessible, for example, across borders, but also across different silos and disciplines. I was at a meeting the other day and had a report from Germany, actually, where they said the largest German hospital, the Charité in Berlin, they cannot even exchange data between different departments in the same hospital. So that's one of the big challenges. I see people nodding, so that's that's a good sign. So of course it supports standardization, harmonization, and this is a big part of it. But it's not about setting the standard for an electronic health record. This is not the scope of this call. With a particular focus here again on privacy and security, because that is one of the big sort of obstacles, or let's say worries in this respect when we're opening up these records, when we're exchanging them. Who's going to hack into them? Is it going to be safe? Who can I trust? this is a good opportunity to mention the sort of new legislative framework that we're looking at, the General Data Protection Regulation that will be, let's say, enforced from May 2018. And there's an explicit reference here to that, and it has to take care of that. So the provisions that are in the General Data Protection Regulation in Europe, which is implemented in the member states in the health field, will have to be regarded here. So the scope is development and testing. So that's again important to say. And we are looking at a platform here again, a platform that allows sort of plugging into others and to sharing with others via an exchange format. And we take the perspective of sort of a citizen-centered approach. So somebody is clearly a platform that can be approached and accessed by citizens and or patients, whatever their role respectively is. It must be easy to use. It must be clearly understandable. It must be secure, as I said, and have the necessary data protection provisions. The idea is to make it work through harmonization and standardization, but that needs to be assessed in the project as well. What kind of standards need to be applied, if the necessary standards are there, or whether we can draw on existing ones. I will go towards the impact of this one. Of course, this can only be done if you involve all the necessary stakeholders. That is, those that have the data already, those that collect the data, those that the data affect, and also those that want to use the data maybe in a different context, or those that want to enrich the data. Think well-being apps, for example, where data can be generated and perhaps integrated or not, depending on the application area. And there is a clearly defined or expected impact. There are already quite a lot of efforts being made. For example, in the context of a different funding stream called the Connecting Europe Facility, CEF, where member states start piloting data exchange, for example, between individual hospitals. This is not replacing this. This is complementing this. This is important to mention. So this is why we're actually referencing this here explicitly. But it is also an idea to sort of widen that, to not go just from sort of hospital to hospital based on sort of a mutual agreement, but also to provide an infrastructure, a platform, and a format that lets others come up with solutions to plug into this data. So that's the idea behind this one. As I said, it's also a research and innovation action. We have indicatively put 30 million euros on this, a little bit smaller than the other projects, but I think it is realistic to say that we will fund 3, 4, or 5 projects in this topic. There's a question. We need a microphone because it's streamed.
Please say your name and where you come from before you have your questions.
So my name is Vedran and I come from my own company, Vedran AB. And I've been working in Swedish healthcare national systems, and we have been doing similar systems like this for years. And the government has spent hundreds, maybe 1 billion crowns or even more. And it doesn't work. So what makes you think that the project of 30 million would work?
First of all, it's a prototype. That's the first thing, and the second one is what we need is the validation of the prototype. But the idea that it is a collaborative European project. That's what we think can help here. And if we have these national starting points, that's actually even better because we have these experiences and we know why it didn't work in your case. Perhaps I don't know.
We do know.
Yes, exactly. So. And that's the sort of the idea behind this. And this will be, I cannot give you all the details now because we are preparing the policy communication about this. But there will be accompanying policy measures that will support the success of this. This is as far as I can go, because it needs to be adopted on the political level. But we're looking into the possibilities or the necessities, perhaps, to take legislative measures that point into that direction that would support that, because we also receive a lot of questions and experiences from member states that tell us it's really good to approach this, to try it, but we need guidance, but we need maybe even more than guidance. We may need legislation, for example, to make it work, because otherwise we will not get the buy-in of all the stakeholders. I think that's there's a lot of conservatism in the system, if you like, and it may need a little bit of a push from the legislative side, but that's why I'm saying that this will be accompanied by these policy proposals. That's all I can say at this point, because we're not quite there yet. But we expect the communication to be adopted early 2018. So before the deadline for this proposal. Okay. Good. Then this one is pre-commercial procurement. So we actually have quite a lot of experience with this instrument in Societal Challenge 1, in the health and aging and well-being, and it is something that is, to be frank, is challenging to those that are in it, because it needs a lot of coordination between the partners in different contexts of application, for example. And when we're talking about procurers, public authorities that spend money, it is at times quite challenging to coordinate that. That being said, it is very rewarding to have common specifications, for example, and to know what kind of solution you're looking for, and also to draw on the experience of what can work and what cannot work from others. So this is why we're putting this one in. It's quite broad in terms of its scope of application area. By the way, this is one of those that has the deadline in November, so a little bit more time to prepare this one. But it's clearly targeted at, if you like, cost-effective health systems through innovation, technology supported innovation. It's not technology-driven. That's in the Societal Challenge, we don't like that idea of being technology-driven, but we like the idea of sort of reaping the potential of technologies. And in this case, I would like to actually point out all the topics that are mentioned here in the scope, because it gives a bit of a variety of what is called key areas that could be addressed. So from patient empowerment in general, self-management, patient safety, the involvement of patients in decisions and disease management, for example, chronic disease management, diagnosis, hospital and care logistics, skills, and independent living. So a lot of fields that are covered by other topics as well, but this one clearly focusing on the sort of joint specification of solutions that come from providers, come from companies, SMEs preferably, and applying them in these areas. And the ICT domains that are being looked at here: telemedicine, mHealth, Internet of Things, open source platforms, and so on. So it's deliberately broad, so that it leaves enough room to find the actual application area that is looked after by the procurers. So so the idea here is to find these partners that say, yes, we see a challenge here. We see an opportunity in, for example, rolling out a new integrated care system, and to specify our needs, and to then take the co-funding from the European Commission, which takes a little bit of the risk from our shoulders, and procure that. The impact, of course, we want to increase the likelihood of these solutions to be applied, and we would like to also sort of to give an idea to the providers, to those that look for the markets, to look for those that would buy their solutions, to understand what is actually needed. And it's sometimes surprising to see that in these projects it's the first time that somebody says, oh, after 20 years of working on a particular technology, I finally understand what I'm doing this for and what it can be applied for. And this kind of project gives an opportunity to define that. So the pre-commercial procurement is an opportunity here. As I said, the submission deadline is in November, and the budget is 22 million with a size per project of 5 to 6 million. There is, and I have to say that, an accompanying coordination support action for this one, but not only particularly for this one, but for pre-commercial procurement in general. I will talk about that in a bit, because do you want me to go on, or do you? Yeah. Now I want to introduce these coordination support actions. They are smaller projects in terms of the budget that we're giving to them, but they are really important, and they have proven to be very well, crucial actually in actually generating the impact that is expected from the research and innovation actions. And I would really encourage you to look into them, even if the budgets are not quite the same size as the others. This one is born out of a very hands-on pragmatic exercise that we did. As I said before, we've had a lot of research and innovation projects on independent living, on Internet of Things, on smart homes, on assistive technologies. But we do not really see that taken up in real life. There are not many people who actually invest in independent living solutions, especially ICT-supported ones. You may see the odd home adaptation for accessibility. You may see some things that people call smart homes, but actually it's more or less just, you know, a button on your phone that I don't know, you can use for the blinds, or you can switch off your kettle. But there are so many more opportunities that have been proven in research and in projects, and we think there's a big opportunity to actually roll that out. And because we saw that gap, we have talked to initiatives, to authorities, to regions, to providers, to users in several member states. We've actually organized a roadshow. We went to places and talked to people, and we saw great pilot projects in Spain, in the Netherlands, in Denmark. And what we always heard was there is not enough courage to take a little bit of money, invest it, and actually make that happen, both in the private sector, but also from the public side. And what is needed is security as to actually what are the specifications. What is it that makes a home age-friendly, for example? What is it that enables me to stay in my own home for longer? What are the technologies that I can apply? What are the accessibility requirements? There are standards out there for accessibility, but it's not comprehensive enough to actually support that. And for that reason, we have worked with stakeholders, as we call them, on a European reference framework for age-friendly housing. This is emerging, this is developing, it's not finalized. And this coordination support action looks into certification of these sort of aspects of age-friendly home conversions, but also for newly built homes, and with a view to encouraging and making investment decisions easier, so to say. If we're complying with these criteria, if we get the certification, then we are likely to have an impact at the local and regional level, and we can make the investment. So what we're asking for here is to develop a certification scheme based on the emerging European reference framework, and to combine the built environment aspects, so accessibility aspects mainly, with technological aspects, sensors, for example, but also home care solutions, telemedicine, telemonitoring, these kind of things, and draw up this certification framework, and to cooperate with potential stakeholders on the adoption of such a framework. We're not asking this to become a European standard in the project. We cannot ask for that anyways. But we would request those that propose for this topic to sort of seek as much agreement from stakeholders that this could work as possible to prepare a European standardization or a certification, not standardization, I have to say. It's one of those that have the deadline in April, and there's 1 million for this. So as I said, this is a smaller amount. And the sort of conditions for coordination support actions are a bit different, but you will find them also in the general annexes, the conditions for the different types of projects. The next one is the one that addresses one of the 3 O's that Johan was mentioning, the open to the world aspect on international cooperation. Basically, what this one is asking for is to develop a roadmap for future international cooperation on health and care innovation. And of course, there's a lot of things going on. We have joint calls with different countries. We had a robotics call, for example, last year with Japan. We have cooperations with Brazil. But there's no sort of coordinated strategy or roadmap on how to take this forward, also with the view to the next framework program, for example, and the next funding round. So this is what we're calling for here. A part of that will also be to raise awareness of these existing initiatives and approaches that is not always there, and that needs to be supported here. It's a coordination support action, so it will have administrative tasks. It will have tasks around networking and those kind of things. Again, the impact idea here is to have a clear European dimension with outreach to the world, which basically means that we are learning from others, but we're also, of course, with the economic dimension, looking into different markets for solutions that are provided. This one has 2 million funding behind it, and again, the proposals are expected to be submitted by the end of April. Yes, there are particular conditions for this one. So one of the partners has to be one of those countries that the cooperation will be sought with. So it's a bit of an additional criterion that you have here, and you also have to look into ongoing work that the G7 are doing in their work on demographic change and innovation, and that will have to be respected. Otherwise, the proposal will not be eligible. Another coordination and support action is support for strategy and early adoption in digital health and care services. This one is the one that I mentioned in the context of the PCP, because it actually has a target of enabling preparation of a pre-commercial procurement, so of a joint pre-commercial procurement by several procurers from different countries. This is not the only goal that we're asking for here, but it is something that we think could help in sort of an early definition of a common goal of these procurers, because otherwise I have to get to the end. Otherwise the proposal cycles, the deadlines are too short sometimes. So that's why we're putting in this project to allow for sort of a longer preparation of a joint procurement. I will have to speed up, I'm afraid. So again, it's in April. There will be more calls on procurement later in the work program, and also towards the end. So this may be a way to prepare that, which will come later in the program. And another one which is really important, which I would really like to point your attention to, is this coordination support action on the transformation of health and care in the digital single market. This is the one that covers all the pillars that I mentioned earlier on, and it is clearly about building on existing networks, for example, the European Innovation Partnership and Active and Healthy Aging, the eHealth network, those that I've mentioned, and others, and sort of providing the tools, the cooperation opportunities, the administrative support to put these priorities into action, and including perhaps the legislative proposals that I mentioned earlier. It includes something like collecting lessons learned from others, replication, twinning, transfer of solutions from one application area to another one, and as I said, the expected impact is that whatever is defined in these policies is actually implemented, and not only for the sake of it, but for the sake of enhancing quality of life of European citizens, the competitiveness of European industry, and the sustainability of health and care systems. So these are the three headline goals that we're looking into here. And we expect this to also pave the way for sort of vision beyond 2020, which will also then be impacted by the next framework program, which will start in 2021. There are 4 million euros for this because it is quite a substantial task that we're looking at here to roll that out. But we think that with this funding opportunities that we have in Horizon 2020, we can actually help bringing this to the ground. How much time do I have? 5 minutes? Not even 2? Okay. Okay. I would just like to mention that when we said before, do not only look into Societal Challenge 1 and look into other parts of the program as well. We do have an instrument or a mechanism in Horizon 2020 which is called focus areas, where we combine, for example, societal challenges with the idea of leadership in technology. And this is what we're doing in some of our topics. And please do look at them because the budgets there are quite substantial. And the focus areas that I would like to draw your attention to are digitizing and transforming European industry and services, and boosting the effectiveness of the security union. So clearly the security aspect and the digitization of industry, and both of them have a clear health dimension this time around. So that's as much as I would like to mention here. Just to be as quick as possible, we're asking for a toolkit for assessment of security risks and how to approach them in hospital environments, including home care scenarios and the combination of home and hospital care. So this is really important because everything these days in IT is about security. So it's really important one. And the second one is supporting this one, which is more about training and awareness raising, mainly among staff, on security risks and how to address them and how to avoid risks, for example, of data breaches. So really important ones. And a last one to wrap it up that I would like to mention is the fact that we also have something called digital innovation hubs, which are sort of regional ecosystems, if you like, for innovation. And in this work program, we will have one priority area, which is healthcare. And this one takes budget from another part of the program and puts it into sort of real world implementation scenarios for healthcare in a sort of multi-stakeholder approach. And in this case, we have 16 million euros for that. And if you want to know more about that, 6th of December, which is the week after next week. No, it's next week, I'm sorry. In Brussels, look at this website if you're interested into this. It's a specific new idea of sort of funding, which is a bit different from classic research and innovation projects. And I think with this, I will wrap it up and open for questions. all the links are here.
Do I have any questions? Or you're so full with
I
information?
know it's a lot, I'm sorry.
No, but it was really good. Thank you very much. I will start with, I just again clarify a couple of things.
Sure.
You talked about, I really liked you talked about this coordinate and support actions. And did I understand you right that this kind of project can have impact on research and innovation actions? What do you really mean with that? Could you tell us?
One of the things that we're trying to achieve is that we do not have siloed projects. And the coordination and support actions can play a really good role in creating synergies between different projects and making people talk to each other, and also in sort of drawing findings and results from projects and making them available to others. Because, of course, there's a policy of opening results, but in many cases it's not really used. I was glad to see that you were using the open data a lot, which is fantastic. But sort of this catalyst facilitator function that coordination support actions can have is really important, and that's why we keep having them in the program. And also, as I said, not only between research projects, but also with the real world, if you like, and existing policy stakeholder networks, this kind of thing. So again, it's supporting and contributing to the impact idea.
So they might influence upcoming calls. And
oh yes,
even.
Absolutely.
So if you have a coordinate and support action, that might be results from one of these, that it be a new research and innovation call in an area.
Or we can also have scenarios where you think that they validate, for example, that a result is useful, should be taken forward or not. So that's exactly how this works as well. And we look into those results when we prepare the work programs, obviously.
Nice. And if I understand, I think you also say that it also might have an influence on the next. I mean, Horizon 2020 won't last forever. It will end soon, 3 years left, as Johan told us. So a coordinate and support action even can have an impact on what's coming up next.
Absolutely. And in some cases, we explicitly ask them to identify challenges that should be tackled beyond 2020. So that is absolutely the case. It's one of their functionalities is to generate this knowledge about what needs to be tackled next.
Good. Thank you. And why I'm pointing this out so much is because we have a lot of coordinated and support action in the health area now. In this DD Connect part of the work program, but we also have the other part in the health area that is R2D, the research part, and they have so many coordinated and support action in this work program coming now. And usually it's 1 or 2, and I think it's about 10 or something. So just to let you know, it's really important to participate in this kind of project too. Do we have any questions? You understand everything? Are you going to apply to any of these calls that you have heard about today?
One question you didn't ask, maybe I would ask.
Yes.
Who has unsuccessfully applied for a Horizon project, if I may ask? Okay, so a few.
And when you say successful, then you led me into what's the success rate?
Well, it depends on the instrument that we have. In the most competitive calls, we are clearly in single figures.
Yeah.
Depending on the size of the projects and the budgets, of course. Coordination support actions are way higher because the budgets are smaller and we have fewer proposals. So it really is between single figures. I think the extremes, maybe not in our calls, but I've heard of calls with 2 or 3%. But we have usually we're talking about something between maybe 10%, and for CSAs it's up to 50% even.
So another reason to go into the CSA, it's better success rate, even it's only one project. We have a question more here.
Hello, one more question. So how do you measure success after the project has ended? What is the, do you have some kind of measurement a few years after if it's a successful project or not?
We're working on it. Let's put it like that. Actually, it's one of those the questions that we ask frequently, and for a reason, because the ex post has, let's say, has left some room for improvement a lot. what we're doing now, especially with these research and innovation actions, we are developing a new mechanism for that throughout the project, but also beyond the project. It is called the Innovation Radar. And that is something that will be an incremental part. It will be an integral part, I should say, in FP9, the next framework program, where we are looking into the actual sort of real-world innovation that comes out of our projects, and not necessarily on a project basis, but we're looking into individual beneficiaries, partners, and solutions that are coming out, and how they are adopted in the real world. And that is will be enshrined in the texts actually, and we have sort of measurements and methodologies to monitor that. Yes, that is happening.
Okay, thank you. I actually had another question also on this with the success rate. You have 1 or 2 stage application. We haven't mentioned it, but could you say something about that?
All these codes that I have presented are 1 stage.
So you're writing 1 full application?
You're writing a full application, and it will be fully evaluated.
Yeah. Could you also tell me something about the development in your area, the work programs? I know we have had in this area, especially that drops the success rate, is that we have a lot of applications below threshold, and that's not that unusual, that it's a high percentage of the proposals. Then could you say something, is it some changing that we need to be aware of if we're going to write an application in this area?
I wouldn't say that there are sort of fundamental changes now between the work program 16, 17 and the one that I just presented. But what I would like to say is, when you're preparing a proposal, please make sure that you are addressing all the criteria and sub-criteria. It's the excellence of the proposal is really important, but it was in the evaluation, in order to be successful, what you would like to do is also look into how you implement the project and how you frame and phrase the impact that it will have, because that can sort of make or break the success of your proposal. It's not always about being, I don't know, the most creative or the flashiest one. Of course, we like good ideas, absolutely, don't get me wrong. But if you then fail to have a convincing work plan, for example, or if you fail to define the right measurements for the impact, then you will most likely not be funded, and that's a pity then, if you have a great idea. So that's what I would like to say, and it is the problem of many of those below threshold proposals. There are proposals in there that have excellent ideas, that have excellent science, but still end up below threshold because they were sort of weak on one of the 2 other criteria. So that's what I would like to say. And even when we have a threshold of 12 out of 15, if a proposal has 11, it's still a good proposal, but it does not have a chance of funding because the competition is high. That's what I can say.
But you in the room are the best, I'm expecting now, when you've been listening to Horst today. I mean, you have heard that you really have to think of what says the text, read the text carefully, and you really pinpointed out some good things to think about when you read in the text, how to read the text. So it's not only to read the text, it's also how you really interpret the text and the political context.
I know it's a fine line between sort of just replicating the core text in a proposal. That's not what we want. No. But what we want is that you take it seriously, that you actually look at these pointers and markers in the text, because there is a reason why they're there. And the example that I gave with the title of the topic saying full exploitation, that sort of should point you towards the fact that we are building on experience, for example.
So you need to take into account all, if it's 5 impact lines, you have to take into account all 5, not only 2, even if I don't just like the 2 of them.
Exactly, yeah. Even you think, why are they putting that here? Believe me, there is a reason why we're putting it there. And you should think about how the impact will be affected, yes.
Okay, we have another question back here.
So, how much does a reviewer of the application, how much time does he or she has to, let's say, application of 60 pages or something?
You have to believe me that there is no one answer to that question. it depends also on actually on the particular topic. Even we do calculate that differently depending on the budgets, on the complexity of the topic, and of the number of evaluators that there are. But what we do I can only speak for DG Connect now. The way that we're doing in these one stage calls. We have actually reduced the number of proposals per evaluator in order to take a bit of workload from them since FP7 and also since the first calls in Horizon. Usually an evaluator looks at in the bigger calls between 6 and 12 proposals. And they have several weeks to do that in a remote phase, but we do invite them for on-site consensus meetings in Brussels in their teams, and we have a very sort of thorough process of calibrating the panel for all proposals. So that's to be honest, I think the way that they're evaluated, there can always be improvement, but it is quite efficient and effective. The projects that we get in the end are good. So that's there are exceptions, but we're quite happy about that. But the time really depends on the complexity of the project, and the time that they actually spend on it is not necessarily the time that they are reimbursed for. That's another thing. But of course, there's only a limited budget for that as well. But I don't know what your experience is, but my experience is that most of the time they would spend at least half a day on reading a proposal, and that's, excuse me, depends. So it depends on the complexity of the call and the topic, but that's a rule of thumb that I would give. But with the numbers of proposals that we have and the difficulty of finding a lot of experts that don't have a conflict of interest, because there's a lot of interest in the calls. That is another challenge, but the pool is growing, thankfully. So and we've recently, I think we've had really fair and thorough evaluations. I can say that with a good conscience.
Okay, thank you. Now I missed what I was going to... thank you very much. I just wanted... We had a discussion before that your FAQ that you can find on the participant portal.
Good point.
Please have a look at it.
Yeah.
It's really good in this area.
There is, on the participant portal, there is a general FAQ section, and a lot of these questions and answers are on how to submit a proposal, general how to use the portal, this kind of thing. But there are individual FAQs for every topic. And whenever we receive questions on particular topics, we turn them into an FAQ and publish them on the portal to ensure fairness, that everybody gets the same information. And in the topic page itself, you will find a link that gives you the FAQ specifically for that topic. So look at that. So if there's something unclear in the text, there's a likelihood that you will find an answer to that in those FAQs. Otherwise, get in touch with us, ask the question, we will answer it and put it on the portal as well.
And you can also contact our Malin, my colleague at NCP, and myself if you have questions.
Yes.
I had just one thing. We had this about the political context that's important. I think you pinpointed something that's really important too, and that's the history in the field. Mm-hmm. If there is other projects in the field, you have to look it up. And then this visualization tools and the dashboard, it's good to see what's have been done.
Yes, absolutely. In these topics that I presented, there's quite a few that have a history. Specifically, as I mentioned, on independent living, for example, on prevention and early detection. Usually they have a history even since FP7 or even it's FP6. It's good to be aware of what has been done there. It's good to be aware maybe of who has been involved in these projects, especially since they're always sort of multidisciplinary, and we're asking to have representatives, or we recommend to have representatives from the user side, from the supply side, and from academia, but also from the application. So this awareness is important, but again, it's not a requirement, or it's not necessarily a big advantage if you were involved in one of those projects before. So that's one of those things we actually encourage new consortia. We do not always want to see the same faces in these projects, this kind of thing. So look at them and draw your conclusions and make them better. That's what I would say. But the open data is there.
Yeah. Thank you very much. And if you don't have any further questions, I'd like to thank you very much for this really comprehensive and good presentation.
Thank you.
I think it will be very helpful.
Sorry for rushing in the end, but you can read it up and and as you said, get into contact with you. Specifically, maybe that's one thing to mention. If it's about particular aspects of your proposal or the consortium, we are not allowed to comment on that in Horizon 2020 as the Commission. So it's about, if you have questions about the topic itself, about the call context, yes, clarifications on what is written there, but we do not check proposals, we do not comment on individual consortia. That's it's not allowed.
No, and that's good. It's a good thing for us also, because it should be equal. But have a look at the FAQ. Even if you don't have a question, you can look at the FAQ, because sometimes others' question can be good to read and see if you are going to apply in a specific field.